Okay, so we'll be discussing today about the hypersensitivity reaction or allergic reaction. Okay, so when speak about the hypersensitivity reaction, so this is just your exaggerated or heightened immune response against your allergen. Okay, so however, if left untreated or left managed, this can lead to your tissue damage, tissue injury, and eventually lead here to death of the patient if left untreated. Okay, we have here some terms related with our hypersensitivity reaction or allergic reaction. So first we have here allergy. So when speak about allergy, so this is just an altered reaction with a normal immune response because of a triggered primarily by the presence of your offending antigen in the form of your allergen. Atopy, on the other hand, is just our inherited tendency to mount an allergic reaction against certain allergens. So it would have a genetic basis. You have that one already inside your body. And most likely your atopy here is an immediate response against the presence of your IgE preformed IgE synthesized in your muscles and your basophil. It is more of an immediate type of your hypersensitivity reaction. But again, it's just a genetic basis. It's just because of your human leukocyte antigen responsible here for the influencing our tendency, genetic tendency to respond to your allergen. So we have here also here the term allergen. So allergen here is the offending antigen, okay, that try to trigger our allergic reaction. The allergen considered here to be that may be able to enter your body through your respiratory tract by inhalation or by gastrointestinal tract through your ingestion. Okay, so we have your example of the allergens. So it might be in the form of your environmental allergens like your pollen grains, your dust mite, we have your animal danders, or maybe we have your infectious agents like your microbial organisms, like your bacteria, viruses, parasites, and all of that. Or maybe self-reactive antigen. So it can also trigger your allergic reaction, especially for our immune-mediated type of your hypersensitivity reaction. Okay, we have here the summary of our hypersensitivity reaction or allergic reaction. Actually, there are four of our hypersensitive reaction or your allergic reaction. Type 1, type 2, type 3, and your type 4. Okay, for the type 1, other name for that is your immediate type or anaphylactic reaction. Type 2 is your cytolytic. Type 3 is your immune-mediated. And type 4 will be your delayed type hypersensitivity reaction. Okay, for the immune mediator responsible here for the manifestation of the allergic reaction for the type 1, we have here the IgE. So we're talking about here the IgE attached to your mast cells and your basophil. So they call it once your sensitized IgE being attached to your mast cells and your basophil. Primarily triggered or being produced here, being sensitized on the first encountered with the antigen. But in the second encounter with antigen, it tried to trigger eventually the degranulation of your basophil and your mast cells. Okay, once your allergen tried to bind with your IgE, which has been sensitized with your basophil and your mast cells, that try to trigger the granulation of your basophil and your mast cells. And the granules of your basophil and your mast cells would be the one responsible here for the manifestation of our allergic reaction. Okay, for the type 2, so we have here your antigen antibody. So basically, you have your antigen found on your, pwede siyang sa cell natin, like your RBC, or even in your tissues where your corresponding antibody trying to bind to that. Once you have already your antigen antibody complex, okay, it will activate your complement, resulting to the removal of that antigen antibody complex. And of course, also it trigger also here the activation of your phagocyte. For the type 3, we have here the immune-mediated. So what you have here would be your soluble antigen or free na antigen. Hindi siya nasa surface na, but rather sa free antigen. Then you have your antibody that try to combine with one another, and the immune complex will be deposited to our tissues. And once you have your immune complex already in your tissues, Okay, it will try to trigger also the activation of your complement and your phagocytes, and that's responsible here for the manifestation of your allergic reaction. Okay, the type 4 here, what mediates for the hypersensitivity reaction for the type 4 would be your sensitized T helper. Okay, so sensitized T helper here is being produced primarily during the first encounter with your allergen or your antigen. And on the second encounter of the same antigen, okay, it try to combine with your sensitized T helper that will allow your sensitized T helper here to release your cytokines. And the release cytokines of your T helper will be the one responsible here for the manifestation of your allergic reaction in your delayed type hypersensitivity reaction or type 4. Okay, so we have here your antigen type. So we have for the type 1, we have your heterologous. Again, heterologous is, okay, so could be, I think, homologous, heterologous. Okay, that's your non-self. We have autologous, heterologous. So that's yourself and your non-self. Same through with your type 3 and your type 4. Complement activation here only involve this one. Okay, type 2 and type 3 because of you have your antigen antibody complex which try to trigger our classical pathway of our complement. Okay, we have here also example of your type 1. So this includes your hay fever. We have your anaphylactoid reaction. We have your allergic rhinitis, asthma, and we have also here your food allergies. Okay, the type 2, we have here your hemolytic transfusion reaction, hemolytic disease the newborn, and we have also here other autoimmune disorders like good pasture, Hashimoto thyroiditis. We have also here myasthenia gravis, and we have your type 1 DM. Okay, the type 3, this includes our serum sickness, arthros reaction, and we have also here the autoimmune disorder, systemic lupus or erythematosus, and we have your rheumatoid arthritis. Type 4, we have your contact dermatitis, hypersensitivity pneumonitis, and we have also here your tuberculin skin test. Okay, or the sensitivity here to your skin test. Okay, so we discussed first here the type 1 hypersensitivity reaction. This is your immediate type hypersensitivity reaction. So we have here the entire reaction or the picture of our type 1 hypersensitivity reaction. Again, your type 1 hypersensitivity reaction is triggered by your IgE sensitized attached to your muscles and your basophil. And once your allergen try to bind with its IgE sensitized to your muscles and basophil, it will trigger the degranulation of your basophil and muscles. So we're going to release the content of their granules. And the content of their granules here of your basophil and your muscles here will be the one going to be responsible for the manifestation of your allergic reaction. Okay, we have the clinical picture. So just exposure to your small molecule na allergen that would trigger the increased production of your IgE. Okay, so we have here, we're going to discuss it one. So again, during the first encounter with your antigen, the antigen enters our body through your respiratory tract or gastrointestinal tract. Okay, it's because much of our allergen could be coming from the food, diba? So that become your gastrointestinal tract or from the inhaled na mga antigens, so that's your respiratory tract. Okay, once your antigen enters those part of our body, it eventually trigger the immune response that will eventually result here to the production of your antibody. You have your plasma cell, antibody forming cells on that area in your body, and therefore that be responsible here for the production of your IgE as your antibody. Again, this one is as a response, in response to your allergen that enter your body, either by gastrointestinal tract or by your respiratory tract. Okay, what trigger primarily the production or what helps here in order for your body for your B lymphocyte to become plasma cell here would be your T helper 2. Okay, the T helper 2 try to secrete the following cytokines. We have interleukin 3, 4, 5, 9, and 13. All of this one helps here in order for you to produce your IgE. Okay, so like for example, interleukin 4, interleukin 13, okay, responsible here for the final differentiation of your B lymphocyte to become your IgE as your antibody. Interleukin-5, interleukin-9, responsible here for the development of your eosinophil. Interleukin-4, interleukin-9, also for the development of your mast cells. And we have interleukin-4, 9, and 13, okay, for increasing the mucus gland secretion as a manifestation of your allergic reaction. On the other hand, your T helper 1 try to produce here the following cytokines. We have your gamma interferon. We have also here interleukin 12, interleukin. We have also 18. We try to suppress the production of your IgE. So again, your allergen enter your body through your respiratory tract or gastrointestinal tract that would trigger the development of your plasma cell to become your IgE with the help of your T helper 2. And if you already have your IgE would have a receptor. Okay, so IgE were able to bind your cellular body if that one contains the receptor. You call the receptor here as your FCERI receptor. So if your cell contains that FCERI receptor, the IgE produced here, okay, will eventually able to bind. Okay, so what are the cells in our body containing here your FCERI receptor? So you can have your, okay, basophil, you can have your mast cells. Aside from that one, you can have here your monocyte, eosinophil, Langerhans cells, and dendritic cells also try to possess your FCERI receptor. Only that the receptor here for that is decreased. So most likely, dito siya magbabind sa basophil and your mast cells. Okay, so pag nag-bind na siya dito, you call that one as your sensitized mast cells and your basophil. Okay, so we have also here the genetic basis here why some patient would have increased chance of being prone to allergic reaction. That's being explained here by our human leukocyte antigen because they have HLA DR2, DR4, DR7. We try to trigger most likely here for them to become prone to your allergic reaction because of that human leukocyte antigen. Okay, next on the second encounter with the allergen, so the allergen here try to combine with your IgE, sensitize to your mast cells or basophil, that will trigger the degranulation of your basophil or your mast cells. Okay, and the content of the granules of that will be responsible here for the manifestation of your allergic reaction. Okay, as for the granules of your basophil and mast cells, we can classify that one as your primary mediators, or you can as your immediate mediators, and we could also have your newly synthesized mediator. So first we discuss the primary mediators. So the primary mediators here are actually the content of the granules of your basophil and masses which are being released as early as or as immediate as 30 to 60 minutes after the contact of your allergen with your IgE sensitized to your masses and your basophil. So this include the following here. Number one, histamine. Okay, so depending on where your allergen here were able to bind with a receptor, with a histamine, it tried to have here the following manifestation. For the H1 receptor, the histamine here try to be responsible for the following manifestation. So we have contraction of your smooth muscles in your respiratory tract or your blood vessels. We have also here increased capillary permeability. Then we have also here your increased mucus gland secretion to your pulmonary lungs. Okay, the H2 receptor will trigger here the increased gastric acid secretion. Okay, increased mucus gland secretion, and we have also increased capillary permeability. Okay, and the H3 found here in your peripheral and neural tissues. And for the H4 receptor, on the other hand, okay, so that one is found here with your bone marrow and our granulocytes, including our neutrophil, basophil, and our eosinophil. This one is triggering here the chemotaxis of your mast cells and your granulocytes, and also for the secretion of your cytokines. Okay, overall, we have here the effects of your histamine. Number one, okay, for the skin, it try to trigger here the erythema or redness. You have also here your flare, your wheal, erythema, ganon, redness. On the other hand, we have here, it also try to trigger the contraction of your blood vessel found in your pulmonary tract, your blood vessels. And because of that, it can trigger also here the obstruction, okay, of your airflow, and plus because it tries to trigger also increase your mucus gland secretion, can also result here to the airflow blockage and might lead to the asphyxiation if left unmanaged, or an increase in capillary permeability resulting here to the leakage of your plasma, and that results to your hypotension and shock and death of the patient. Okay, another one na immediate primary mediator here would be your eosinophil chemotactic factor of your anaphylaxis, which try to trigger the chemotaxis of your eosinophil to the tissue site. It also try to induce here the expression of the eosinophil receptor with your C3b complement component. So we have here the contents of our granules of your eosinophil. So we have your major basic protein. We have also eosinophil cationic protein. We have your eosinophil-derived neurotoxin. We have also your eosinophil peroxidase. We have your histaminase. Okay, that's your antihistamine. If your basophil and your mast cells contain the histamine, okay, sa kanya naman is your histaminase or antihistamine. Then we have also your phospholipase D. Another one, a primary mediator, we have here your enzyme tryptase. So we try to convert your kininogen to your bradykinin, and that's why it's responsible here for the prolonged contraction of your smooth muscles and increase also your vascular permeability. Again, those three here are part of your primary mediators. So they are being released as early as 30 to 60 minutes upon contact of your allergen with your IgE synthesized muscles or basophil. Okay, then we go with we have also the newly synthesized mediators. So the newly synthesized mediators here are actually being produced here after 6 to 8 hours of contact with your allergen with your IgE sensitized muscles in the basophil. Okay, so unlike with your primary mediators, this one is being triggered or released as early as 30 to 60 minutes after the contact. So this includes here number one, arachidonic acid. Number one, we have here the products of your icosanoid pathway, or you call it sponsored thromboxane pathway or arachidonic acid pathway. We have your prostaglandin. We have also your leukotrienes. Okay, so prostaglandin is actually came from your arachidonic acid acted upon by our enzyme cyclooxygenase. Okay, so prostaglandin try to mimic here the effect of your histamine. It would have your more potent effect compared with our histamine. Leukotrienes, on the other hand, is a product of your icosanoid pathway on which your arachidonic acid is acted upon by the enzyme 5-lipoxygenase in order for you to convert your arachidonic acid here to your leukotrienes. Includes your LT, leukotrienes B4, C4, D4, and E4. Leukotrienes C4, D4, and E4 are considered to be the slow reacting substances of anaphylaxis because of course they are only being triggered after several hours, so medyo delayed ang kanilang effect or activity. Your leukotriene C4 and D4 are considered to be 100 more potent compared with your histamine in terms of its effect. And your LTB4, leukotriene B4 here, try to induce also your chemotaxis of your granulocytes, including your eosinophil and then your neutrophil to the site of your tissue injury or the site where you have your allergen or your pathogen. Overall effect of your prostaglandin and leukotrienes to try to enhance the effect or the activity of our histamine. Okay, another one, newly synthesized mediator, will have here your platelet activating factors. This was being produced by your monocyte, macrophages, our granulocytes, and even your mast cells. So this is triggering here your platelet aggregation, and it's also induces also here the migration of your eosinophil and your neutrophil. Then we have also here the cytokines. This includes your interleukin 1, 3, 4, 5, 6, 9, 13, 14, plus your granulocyte monocyte colony stimulating factor, plus your tumor necrosis factor alpha. Okay, your tumor necrosis factor alpha is actually responsible here for the manifestation of the systemic manifestation of your shock. Okay, so overall, we have here the effects or the symptoms of your immediate type hypersensitivity reaction. Number one, it could have your localized skin manifestation like erythema, wale flares, redness, ganon. Itchiness, and we have also here the systemic. So, pag systemic, that's already your anaphylactic reaction. So the manifestation here would be highly dependent on the route of the administration of your allergens. So if that allergen enter your body through your respiratory tract, so it would have your respiratory manifestation. So nahirapan ka huminga, magkakaroon ka ng mga ganon, asthma and all. If that one has been taken here through your ingestion, so you will have your vomiting, diarrhea, mga ganon. Or if that one enters your body through your direct inoculation or injection, it would have a systemic manifestation. Okay, so we have here the manifestation or the type of your type 1 hypersensitivity reaction. So first one, we have here your anaphylactic reaction. So anaphylactic reaction here is considered to be the most severe form of your immediate hypersensitivity reaction because it's one involving your systemic manifestation. So Porter and Richer try to describe your anaphylaxis here as without protection. So primarily this being triggered by exposure to your large glycoprotein substances or even with your large polypeptide. Can also be triggered even by your small allergen, provided that one should be combined with your carrier in order for that to become immunogenic. So the agents of your anaphylactic reaction could be your environmental allergens like your bee, venom, wasps, hornets. Could also be triggered here by the food or even your drugs. Food like your mga seafoods, ganun. Poultry products could also, or peanuts, could also trigger here your anaphylactic reactions. Okay, for the signs symptoms, we have your bronchospasm, we have your contraction of your um, smooth muscle here, that's your vascular congestion, with a skin manifestation like your erythema, redness, flare, wales, ganon. And we have also gastrointestinal tract manifestation like your diarrhea and vomiting. Okay, the death here because of, again, triggered by the primary mediators like histamine, di ba? They try to trigger your increased mucus gland secretion and eventually obstruction with your pulmonary airflows and result here to your asphyxiation. And a reversible shock here related to your increased capillary permeability resulting to your hypotension and shock. Okay, another manifestation of your type 1 would be your allergic rhinitis, considered here to be the most common type of your immediate hypersensitivity reaction. This is manifested here by sneezing, rhinorrhea, we have also here runny nose, and we have also your nasal congestion with a complication of otitis media. We have also here your sinusitis. So allergen, that most likely would be your airborne, like mga dust mite, your pollens, and all of that one. Then we have here asthma is another type 1 hypersensitivity reaction. So this is characterized by exposure to your large na allergen, usually more than 2 to 4 micrometer in diameter. And it's being described here as your panting or breathlessness. So we describe here asthma as the recurrent airflow obstruction, pabalik-balik, primarily because of nagkakaroon ng airflow obstruction because of your bronchial smooth muscle contraction. We have also here your mucous gland secretions. That results sa your mucosal edema and your mucous secretion. So, hindi ka makahinga. Okay, and this can result here due to your intermittent sneezing, we have a breathlessness, and occasional cough with sputum production. And another type of your immediate would be your food allergies here related to allergy with your mga seafoods and your poultry products. Okay, then we have also the term here anaphylactoid. So anaphylactoid is your anaphylactic-like syndrome, and basically a process, basically this was less severe compared with your anaphylactic reaction. So anaphylactoid here process whereby your allergen tend to bind directly to your muscles and basophil, and then triggering here the degranulation of your basophil and muscles. Even if your basophil muscles here are not synthesized with your IgE, it can bind directly your allergen to your basophil muscles and try to trigger degranulation. So there's no antigen-antibody interactions. Okay, for the treatment, so we can have your drugs here for the antihistamine to primarily decrease the severity of manifestation of allergic reaction. We have also your bronchodilator, especially for those who could not breathe, ganon. So that bronchodilator here try to dilate the blood vessels of the pulmonary tract para hindi siya because there's di ba, there's a mucus gland secretion, increase of that in results to obstruction of the airflow. So you can need to dilate the bronchioles here in order for the patients to breathe normally. Then you can also have here the hyposensitization. Hyposensitization here, the process whereby you try to expose the patient little by little concentration to the offending allergen until the patient try to develop here tolerance and the patient try to develop already a blocking antibody. The blocking antibody is the IgG antibody, which tend to block here your allergen. In order for that allergen here it will bind with your allergen and therefore preventing the allergen to bind to your IgE sensitized muscles in the basophil. So, magbabind siya dun kay allergen and therefore allergen ay hindi makabind sa ating IgE sensitized muscles and basophil. And therefore, it will also prevent your IgE sensitized muscles and basophil to undergo degranulation. Another one, you could have your anti-IgE monoclonal antibody. So, anti-IgE monoclonal antibody try to compete with your IgE with the FcERI receptor in your muscles in the basophil, and therefore preventing your IgE to bind with your muscles in your basophil. So, kung walang nakabind naman na IgE with your muscles basophil, even if you have your presence of your allergen, so it will not trigger the granulation of your basophil and muscles, and therefore you will not have your allergic manifestation. Okay, the next one, we have your type 2 hypersensitivity reaction. So the type 2 hypersensitivity reaction here is your cytotoxic or your cytolytic. Okay, so for the mechanism here of your type 2, so you have your antigen. Antigen here found on the surface of your cell, and your cell here can be an RBC. Then you have corresponding antibody that try to bind on that to form here your antigen antibody complex. Once you have already your antigen antibody complex, it will trigger the activation of your complement and your phagocytosis, and eventually ending up here with the cell lysis because of the activation of your membrane attack complex. Okay, we have an example of our type 2. We have here hemolytic transfusion reaction related to your incompatibility between the blood group, okay, the ABO, or even with your other clinically significant antibodies, which are your IgG antibodies. Okay, so most likely hemolytic transfusion reaction because of the incompatibility between the donor and the recipient normally try to occur here because the recipient possess a corresponding antibody on its plasma in relation to the red cell antigen of your donor's blood. So for example, if the patient here recipient is type B, it would have your anti-A antibody sa kanyang plasma. Then if you try to transfuse that one with the type A na blood, the type A blood contains here the A antigen. So A saka anti-A, so it will have here your antigen antibody complex formation, triggering your activation of your complement and your phagocytes, so magkakaroon ng cell lysis or hemolysis because of that. Another one, we have your hemolytic. This is the newborn because the mother contains the anti-D RHD antibody because of the exposure previously, because the the child or the baby during the first pregnancy is RHD positive, tapos ang mother natin is RHD negative because of the exposure on the the first pregnancy. It will trigger the mother here to develop an anti-D antibody. Then on the second pregnancy, since the mother has already an anti-D antibody and then the baby is still RHD positive, so magkakaroon ng antigen antibody complex formation, and that would result here to the lysis of the fetal blood, and that become your hemolytic disease of the newborn. And then the antigen is already on the surface ng red cell natin. Okay, the type 2 hypersensitivity reaction here also try to occur on the formation of your antigen antibody complex, happening not on the RBC membrane but on the other tissues in our body. So just in the case, for example, of your good pasture syndrome here, where the patient is producing anti-basement membrane antibody, anti-glomerular, that's directed to your glomerulus or your kidney, and anti-alveolar directed towards your pulmonary lungs. So that try to form your immune complex because of that and try to trigger then ang ating activation ng complement and your phagocytosis. Another one, we have your Hashimoto thyroiditis are producing an antibody against your thyroid tissues. Then myasthenia gravis are producing antibody against your acetylcholinesterase receptor in your neuromuscular junction of your muscles. And type 1 DM, you are producing an antibody, autoantibody, directed towards your beta cells of the islets of the Langerhans. All this one try to trigger the formation of your antigen antibody complex, activating your complement, activating your phagocytes, and that one will be the one responsible here for the manifestation of your type 2 hypersensitivity reaction. Okay, the type 3 hypersensitivity reaction or immune complex type would have the same picture with our type 2, only that your antigen here is soluble or free. Hindi siya makikita mismo sa surface natin ng tissues natin or your RBC, but rather that one is free circulating in our plasma. Okay, so then try to combine with corresponding antibody. They form an immune complex, antigen antibody complex, and then that's the only time that one will be deposited in your tissues. So wherever that one, the immune complex there will be deposited, it will activate your complement, activate your phagocytes, and it try to result to the disruption of your removal of your antigen antibody complex, and at the same time also trigger here the damage with your tissues where your antigen antibody complex being deposited as with the action of your complements and your phagocytes. Okay, we have your example of your type 3. The first one, we have your Arthus reaction. So the Arthus reaction has been described by Maurice Arthus. So this is not manifested in a human. So this one is identified by injection of the antigen in the rabbit. Then because of the product of injection, the rabbit here tried to develop an antibody. And then you try to inject an antigen since the rabbit has already an antibody. Then you try to inject the antigen. So they try to meet, they form an immune complex, antigen antibody complex, and that antigen antibody complex will be deposited here in the small blood vessel, triggering the activation of your complement, and of course the phagocyte towards the small blood vessels because you have that immune complex on that area, and eventually resulting here to your inflammatory response. Another type 3, we have your serum sickness, which try to occur in the human. This is a passive immunization by injection of the plasma containing antibody. However, the plasma here antibody coming from your animal source. So it might be the horse or bovine. So this is actually used for the treatment for your diphtheria. We have here your tetanus and even your gangrene. Okay, so manifestation of this one, we have the fever, the headache, nausea. It's self-limited na manifestation, but on the second exposure or subsequent exposure again, it might have here complicated a severe manifestation. It might lead to your vascular collapse. Okay, then we have here the autoimmune disorder related to your type 3 hypersensitivity reaction. So we have here the SLE, systemic lupus erythematosus. This is a systemic manifestation characterized by the production of your autoantibody, anti-nuclear antibody directed towards your kidney cells or glomerulus or other part of your body. Another one, we have the RA, rheumatoid arthritis, where you're producing rheumatoid factor plus anti-nuclear antibody which try to destroy your joints. Kaya nga it would have here the arthritis manifestation. Then we have here the type 4 hypersensitivity reaction. We consider this one as a delayed type hypersensitivity reaction. So what's being triggered here for the type 4 would be your sensitized T helper. So during the first encounter or the first exposure with your antigen, the antigen or the allergen, enter your body and try to prime or try to synthesize your T helper. Okay, and usually it try to be sensitized after 1 to 2 weeks. Okay, after exposure to your first antigen. Okay, next we have here the second exposure. On the second exposure, primarily occurring here after 48 to 72 hours after the entry of your same antigen or allergens, we try to trigger the sensitization of your T helper during the first introduction. Okay, so that's antigen that enter your body will be picked up by your antigen presenting cell and try to present your allergen here to your sensitized T helper. And after 40 to 72 hours, it will trigger your sensitized T helper to release here the cytokines, which are interleukin-3, gamma interferon, tumor necrosis factor alpha, and we have also here the tumor necrosis factor beta. And because of that, the release of the cytokines here will be responsible for the manifestation of our allergic reaction. We try to attract here your phagocytes where the tissue injury or where the allergen is. This also results to your edema and also have here your fibrin deposition. Okay, we have your example of our type 4 hypersensitivity reaction. The first one, we have your contact dermatitis. The contact dermatitis here, type of allergic reaction that's being triggered upon contact of your skin with different chemicals. So it might be contact with your poisonous plant, mga plant extract natin like your poison ivy, poison oak, poison sumac, or even contact with your chemicals like for example your formaldehyde, your cosmetics, or hair dyes, or could also be contact with your trace elements like mga nickel, chromium. So it also trigger here primarily nangangati ang skin natin. That's our contact dermatitis. Another type of your delayed type, we have here your hypersensitivity pneumonitis. The hypersensitivity pneumonitis here characterized by the allergic reaction because of the inhaled allergen characterized here by reaction in your lung, parenchyma. So, nasa lungs natin. And this is a respiratory tract, primarily an allergen, which is an airborne na allergen. So, other name of your hypersensitivity pneumonitis, we have your farmer's disease, pigeon breeder's disease, and we have your lung humidifier disease. And another one, we have your tuberculin. This is your skin test. So, like for example, we have the skin test against your Mycobacterium tuberculosis, like your PPD. Okay, plus that's your plasma protein derivative. Sama ba? Okay, then we have also here Mantox skin test. Okay, and eventually, if you try to inject primarily your allergen or your microorganism to the skin. So after 48 to 72 hours, okay, eventually the patients would have developed here erythema surrounding the injected site. Okay, and that would mean here that the patients have an exposure with that microorganisms. Okay, so I just kinorek. Okay, so we have here that's your purified protein derivatives. Okay, so that's all with our allergic reaction, hypersensitivity reaction. Okay, thank you.